Yeah, older Hodgkin lymphoma is a growing challenge. We have a rising incidence in this population, and due to demographic changes, this patient population is actually ever growing in size. And so far, we haven't been really able to address this because the outcomes remain poor if patients are above the age of 60 and if they are not eligible for our current intensified treatment approaches. And to address this, we need to understand whether there are any biologic differences between older and younger Hodgkin lymphoma patients. And we also need to understand how we can optimally treat those older patients. And over the last couple of years, there have been some changes introduced, namely through the introduction of Brentuximab vedotin, a CD30 directed antibody drug conjugate that can be used either simultaneously or sequentially in combination with conventional chemotherapy, and provided some encouraging response rates and also durable progression-free survival. However, the PFS and overall survival rates, even with such approaches, remain poor compared to the younger patients. And this is why we and others are trying to investigate how to optimally use anti-PD-1 and other immune checkpoint inhibitors in this setting of older patients. So far, this has mostly been done by our French colleagues who had a very nice Nivino trial that investigated an anti-PD-1 based first-line treatment, and that showed considerable response rates, however limited durability. And I think to date, we are not really there yet to introduce anti-PD-1 for the older population, since there seem to be some hurdles that could be associated with patterns such as immunosenescence or other aging-associated immune phenomena. And overcoming these hurdles is something that we as a scientific community actively need to do. And this is why I'm very excited to chair this workshop and really much look forward to discussing biologic insights, but also recent clinical developments in terms of treating older patients with Hodgkin lymphoma.